Happy holidays from all of us here at Kidney Plugged In. Today on the show, we have part 2 of our mini documentary series, A Family's Journey Towards Kidney Transplantation. And then Plugged In was at St. Paul's Continuing Education Medical Conference in Vancouver, speaking to physicians from across Canada about the prevalence of kidney disease in their general practices. And in the true spirit of the holidays, Sidney the Kidney is practicing his caroling and spreading holiday cheer to everyone he meets. So stay with us because it's all coming up next right here on Plugged In. Hi, and welcome to Plugged In. Thanks for joining us today. And you'll be glad you did because we've got something special in store. We're here at the Vancouver Convention Centre for the 65th Annual St. Paul's Hospital Continuing Medical Education Conference. And it's for primary physicians from all across Canada, not just here in BC. And we've set up a little mini studio here, and we've got the hot seat right here because we plan on talking to some of these physicians and asking them a few questions like, how frequently do they see somebody in their practice that has kidney disease? And on top of that, we're going to bring you some highlights of the conference. So stay with us. We'll be back in just a minute.
Hey, honey, I lost the list for Jason's birthday thing. Obviously, hamburger, cakes. No, not hamburger cakes. Hamburgers and cake. And buns, sausage.
Talking. Ooh, eye candy.
Is it a full moon tonight? People are being weird. And don't forget to make the Facebook event private this time. Okay, bye.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.
Okay, joining me now is Dr. Harold Hinge. Did I get that right?
Yes, you did.
Oh, terrific. And you're from Port Dover, Ontario. We were just talking about some of the unique things about Dover, Ontario. Can you tell me a little bit about Port Dover?
Sure. So Port Dover's a lakeside community on the north shore of Lake Erie. It's about an hour south of Hamilton, an hour and a half from London, Ontario. It's in the Norfolk County. It's sort of Ontario's garden, so it's a lovely rural community that now has been transforming itself over the last few years, becoming a retirement haven for people moving from the big city, coming to a small town to get away from the hustle and bustle of Toronto, Oakville, London, Kitchener, that kind of thing.
And we were talking about the demographic that you get in your general practice, right, being in Port Dover, and sort of the linking of that with maybe diagnosis of kidney disease or some of the high risk factors like diabetes.
So these days in general practice, a big part of our population are servicing the elderly. And we're seeing people are living longer, so we're seeing more patients over the age of 80, and they come with multiple comorbid diseases. And I mentioned earlier that a big portion of my practice that we're dealing with diabetes. It's an epidemic in North America. And as a result of that epidemic, we're seeing patients with multiple other issues related to their diabetes, kidney disease being one of them. So I'm seeing a huge jump in that part of in that part of the conditions that we're having to manage on a day-to-day basis.
You were talking about some statistics earlier. You were actually saying in your practice, around 300 patients, and 10% of them might be, diabetic or something along that line.
I figured that In my area, about 10% of my practice is diabetic, and so that accounts for probably between 350 to 400 patients, but they account for 25 to 30% of my daily workload. So it's time consuming. They're complex continuing care issues. They're on polypharmacy. So it's really internal medicine all day long.
You know, something that you said that struck me was you're dealing with a lot of, I guess, even high-risk groups or people with chronic illnesses.
Right. So diabetes puts you, of course, at higher risk for cardiovascular disease. So our goal is to protect the heart, the brain, and the kidneys. If we can prevent heart attacks, strokes, and end-stage renal disease, that's sort of my primary goal as a physician who's looking after these patients. So identifying our diabetics early and then treating them accordingly so that they don't have end-stage complications, which reduces their quality of life, costs the medical system a lot more to have someone on dialysis. And I mean, that's often the end stage of kidney disease is dialysis, and that's not a pleasant life for anyone. I can't imagine doing that, you know.
Is it your first time? Are you enjoying yourself during the conference?
I've been to this conference now. This is my 4th year, and it's a fantastic family practice update conference. I think it's probably in my opinion, it's probably one of the best run ones in North America. So I know Vancouver. I ski at Whistler. I've been here many times. It's a lovely city. So it's a great venue for a great conference like that. And I think the attendance speaks volumes to that, and St. Paul's has been very, very successful with this program.
Well, I know they're glad to have you here, and thanks for joining us on Plugged In. Very much appreciated.
Hi, and welcome to another segment of A Healthier You. I'm Cheryl Christian. I'm a certified personal trainer, sports nutritionist, and author. Today I'm going to share with you one of my favorite recipes to bake during this busy holiday season. The recipe I'm going to share, Fiber Feast bread, is really satisfying. It's a great choice for those wanting to add fiber to their diet and are watching their blood sugars. A slice or two in the morning is a great breakfast idea for those on the run, or a nice pick-me-up during the day. So let's see how we put this together. Preheat the oven to 350 degrees Fahrenheit. Lightly grease a loaf pan. This recipe is great for the upcoming holiday season. Switch out the raisins for cranberries for a touch of holiday flair. It's super delicious. If you're looking for a special hostess gift, you may want to create a gift basket. Include a loaf of Fiber Feast bread, along with some dry ingredients, a gift card to cover some of those perishable items, and a Healthwise cookbook. For today's recipe, go to the recipe section at lowgimeals.com. Thanks for watching today on Plugged In. I'm Cheryl Christian, encouraging you to eat well, to feel great.
So Ava was lucky to have improved kidney numbers, and she had her dialysis tube taken out July of 2012. And so since then, we have been to clinic visits anywhere from every 6 months to every 6 weeks. We're now at a stage where we're at 3 months, and we see everybody at those appointments. So at a chronic kidney clinic appointment, we see a dietitian, a social worker, of course her nephrologist, usually a resident, the nurse coordinator, and it's usually a 2.5-hour appointment. But since then, Ava has been, for the most part, a normal kid. She's able to basically do anything and everything she can with her friends. Her friends support her in taking her medications, which she still has to do twice a day. She has about 13 pills and shots and things that she takes. It has become very much a new normal of doing the pills, and this is what you take in the morning. We got one of the little dosettes that says AM and PM, so she can, I'll put them out, and she then just dumps the AM and takes the pills, and she knows what she's supposed to do and take, and her friends support her in that.
Hi, I'm Barb for Did You Know? Did you know that kidney patients who do dialysis at home produce a lot of extra garbage in the process? Some patients have had to upgrade their municipal garbage bin size or have had to purchase bag tags at a cost of between $100 to $150 a year. This is a financial burden for some. So the Kidney Foundation has reached out to all BC municipalities to ask that the additional garbage fees be waived for those patients. So as a direct result of this initiative by the Kidney Foundation, municipalities are getting the message about additional costs related to chronic kidney disease. And now you know. And we have two doctors joining us here from Ontario. You're from Toronto, Dr.
Kaksanov,
and from Peterborough, Ontario,
Dr. Katherine Valley.
Oh, well, thank you so much. How are you enjoying the conference?
It's great. Yeah.
How many patients would you see that have kidney disease or in early stages of diagnosis, percentage-wise?
I have a high immigrant population, so I think it's higher in my practice, so about 10 to 15%.
I probably have about 10%. I have a more senior practice, so it's a very geriatric heavy practice. So I do have a lot of, chronic kidney disease.
What are some of the high risk factors that you encounter with patients in your practice that are linked with kidney disease?
I think mainly the high-risk groups, so people with high blood pressure, people with diabetes, people with a family history. And I think that what I've learned through my years in practice is sometimes you just don't know. They have no risk factors, no symptoms, and they have early signs of kidney disease.
Right, touched upon that point. That's one of the difficulties that we struggle with Kidney Foundation is that there aren't a lot of warning signs. So when people are diagnosed, they're usually much, later stage, unfortunately, for us. How about yourself at your practice?
Yeah, same thing. It's the risk factors, as we know, the diabetes, the high blood pressure patients, the patients on chronic medications that can potentially affect the kidneys, family histories, obesity, but as Dr. Kaksanov mentioned, most of it is asymptomatic. So you just pick it up on routine screening and people don't really have much warning signs until it's later in the disease. And so that's why it's something important, to have regular follow-up care with your family doctors and be screened.
Well, thank you so much. I know we're on a tight schedule. Grabbed you here before the conference starts again. Thank you so much for joining us on Plugged In.
Thank you.
Thank you.
So what we found with Ava's dietary restrictions is that she's not able, we have to manage her potassium and her phosphorus. Those are ones that tend to make a blip on the blood work screen. And because of that, there are a few foods that she can't eat. We have to stay away from bananas and banana bread, to stay away from kiwis. other foods that are high in potassium, such as potatoes. Luckily, she doesn't really like French fries, so we're good. Any dialysis patient, or any kidney disease patient has to stick away from star fruit, which is an unusual one to find anyway, so that's not really a problem. She has to eat low sodium, but that's been going on for so long that she actually tastes, when it's seasoned with a lot of salt, she actually tastes that. As her kidney disease has progressed, her appetite is lessened, so sometimes that has to be supplemented with Soplena, which is a nutritional drink like a Boost or Ensure that people would take, and then the medication helps to maintain the numbers in her body, or potassium or phosphorus, as well as her blood pressure and even vitamins, the kidney vitamins that she takes. So, and she does a shot every 3 weeks. And it's called, I think, epinephrine, and it actually boosts your white blood cells. But she's used to needles and doing blood work about every 6 weeks, so she just puts her arm out and has it done, and it just is what it is.
I'm a dietitian at St. Paul's Hospital. For all of you who are curious how I turn these black beans into these delicious chocolatey brownies, keep watching. It's very simple. So you'll need a can of black beans, which I've rinsed very well, some vanilla, some vegetable oil, some rolled oats, some baking powder, some cocoa powder, and I've used only 2 tablespoons of sugar for the entire recipe. You can feel free to use a sugar substitute. So now I just have to add these chocolate chips into the batter. And these are the finished brownies. They have protein, fiber, lots of chocolatey flavor, and I bet no one, not even your picky kids, will be able to tell that these are made from black beans.
Dr. Sear, I see you're on a break here from the conference. Thanks so much for joining us here in our little plugged-in studio.
You're very welcome.
So you were telling me you're actually in Quesnel for about 40 years practicing, and now here in West Vancouver.
73 until 2013.
And you came down here to retire, but you're actually still practicing.
I graduated 50 years ago, but I have to give present-day medicine, so I have to come to these courses to update my skills and my knowledge.
So how are you finding the conference this year?
Excellent. The short, sharp lectures are good. They're keeping us up to date, and I've learned an awful lot in this so far this week.
You know, we were talking about kidney disease and the prevalence of it. What are some of the symptoms that you look for or you see in patients that come to your practice that, potentially have kidney disease?
Most don't have symptoms. I'm finding it when I'm looking for kidney problems in diabetics and in patients with hypertension and in elderly folk whom I'm giving medications to, that I want to make sure that they're excreting those medications. So most patients are totally asymptomatic.
Well, actually, you hit it right on the head. That's one of the challenges of the Kidney Foundation, is that it's such an under-recognized disease, and yet 1 in 10 Canadians is affected by kidney disease. When you see patients that have perhaps diabetes, hypertension, some of the high-risk factors, are they aware of the link between that and kidney disease?
Usually not, and they're surprised when I tell them or show them on a graph that their kidney function is less than normal. And so they don't like to be classified as having kidney disease. I think the awareness is low, but when they think kidney disease, they think dialysis, and that's the next step. And they don't understand that this is a very slow, progressive process that needs to be looked after.
So when you see a patient, what sort of things are you might trigger to you that perhaps this is someone that should get their creatinine levels tested, or that they might be at risk of kidney disease?
Anyone with hypertension who's on medications, anyone with diabetes who's on medications. We monitor their kidney function as a matter of good medicine and good course. And so these are people we're looking for that.
You were mentioning a little bit earlier also about the demographic within your practice as well. Is that something also that's a risk factor?
As people get older, their kidney function can, in certain circumstances, start decreasing. And so, if we're going to prescribe medications for that sort of group, we will check their kidney function as a matter of routine. If they're coming in for a checkup because of some other symptoms, we will be checking their kidney function anyway.
Well, thank you so much for joining us. Great information, much appreciated. Taking time out of the conference to join us here today, and maybe we'll see you here next year.
Thanks very much.
Thank you. Well, what an informative day here at the St. Paul's Hospital Continuing Medical Educational Conference. It's been a great opportunity to speak with some general practitioners and learn a little bit more about signs that they're looking for when they diagnose someone with kidney disease. Thanks for joining us. We'll see you next time on Plugged In.
It's the holiday season, and whether you're celebrating Kwanzaa, Hanukkah, Panchaganapati, or Bodhi Day, or whatever you are celebrating, people are out eating and indulging and being with friends and having fun, and we are outside here at the Vancouver Christmas Market. And Sidney, you've written a whole bunch of new Christmas carols. So we're gonna find some people who could try out some of these Christmas carols that Sidney the Kidney has written. Okay, here are some ladies from the QP716, and we have
Lisa, Stacy, Debbie.
All right, here we go. 1, 2, 3. What kidney is this that needs to rest? Because Christmas eating's too stressing. Oh, it's beautiful. It's a beautiful.
I have no idea what tune that even was. I don't even know that song.
You don't know what child is this? No, so you don't even get the rewriting. Now you did, but you know what? You sold it. You did. You sold it and made it work.
She did.
She did.
Well, thank you very much.
All right, Sidney. Okay, Angela and I are going to try another one. 1, 2, 3. You better watch out. You better eat right. Cut back on your salt. Drink water day and night. Your kidney is to last you for life. You can indulge, you can consume, but martyr yourself or meet organ doom. Your kidney is to last you for life. That was pretty good. That was pretty good. Kidney bells, kidney bells, kidneys all the way. Sidney Kidney is the best. Kidney's kidney, yay!
I didn't get that yet.
You did really good. You did really good. There we go. All right, Brendan.
All right.
This one's a little bit more sincere.
Okay.
A little bit from the heart.
Okay, from the heart.
1,
okay.
2, 3. Kidney fright, it's all right. There is help within sight. Your doctor advises the best course to take. Medicine, transplant, or just sit and wait. Kidney disease is not doom and need. There are many options that succeed. You were awesome.
That was awesome. That was fun.
Okay, what's your name?
Guilherme.
Ellen, Ping Pong.
Phil.
Green.
And this is our final Christmas carol. 1, 2, 3. We wish you a healthy kidney. We wish you a healthy kidney. We wish you a healthy kidney and a happy long life. Oh, okay, we sang all your carols, Sidney, and I don't think they're gonna catch on, but you know what, buddy? Your heart was in the right place, and more importantly, your kidney was in the right place. So no matter how you celebrate, happy holidays. My name is David C. Jones, and this is Talking Kidney.
due to the kidney disease, it does affect your brain, and so school, being able to focus for long periods of time can prove difficult. I think with kids that are entering into adolescence, it tends to kind of rear its ugly head at 11, and so Ava at that time was 11 and a half, and it became stress from a school refusal. That's one thing I guess she could control. She can't control how she feels. She can't control the medications that she takes. So this is something that she can control, if you want to say control with anxiety. And she had to see a renal psychologist, Dr. Moon at Children's, to work through that. She started with a medication, and thanks to the support of her teachers, the support of the school, and I guess myself and her dad, we were able to work backwards or work forwards to her going back to school, kind of inched it along for a couple hours at a time, then till lunch, then full days, and then last year was a huge improvement. And again, having the support of her friends has been absolutely amazing, whether they came and got her in the morning and even were late a few minutes because it just was how she got to school. So they've been an amazing support for her.
Thanks to all the car donations made to the Kidney Car program, the Kidney Foundation of Canada can help all these people with kidney disease. Those donations are instrumental in providing them with care and invaluable support. When you give your car to the Kidney Car program, it will be towed for free and recycled or resold. You'll also receive a tax receipt of at least $300. To continue to improve the quality of life of thousands of patients, we need your car today.
Terrific. Well, thank you so much for coming through for us. Yay! We represented BC. We're here at the Vancouver Convention Centre for the 65th annual St. Paul's Hospital Continuing Medical Foundation. Okay.